Dr. Rice, why is alcohol control on an EU level so important?
Well, if we're looking at the population health, and there's a considerable degree of harm to the health of populations that comes from alcohol, there are a number of things that you can do to improve that, but the most important things are often to do with alcohol regulation, the way that alcohol is sold, the way that it's advertised, the way that it's priced. And the European Union has a number of powers that can influence that. So do member states, so do regional governments. What we really need is various different levels of government working together to have effective alcohol regulation that can help us prevent many of the health harms that come from alcohol. This conference is particularly about liver disease, very substantial amount of liver disease in Europe. 3/4 of liver disease in my own country, in the United Kingdom, is caused by alcohol. So prevention of alcohol harm is very important for population health.
You mentioned in your presentation that in 2014 member states asked the EU for support, for example, in cross-border marketing controls and so on. Were there any outcomes of this request?
No, that's been disappointing. There are many things that EU member states can do within their own borders on alcohol harm, but there are also some things that cross-border trade is one example, cross-border marketing of alcohol, particularly through online marketing, is another. And the member states were keen for European help to try to reduce the impact of these. So a country like Sweden, for instance, has quite strong regulation of alcohol marketing, so does France. But their companies were setting up Swedish language stations based in the United Kingdom to get around that regulation, so they could broadcast into Sweden in the Swedish language and have alcohol adverts. And the European institutions were not helpful in the legal challenge to that. And in fact, the legal challenge failed. So that's an example of the kind of cross-border marketing that is of concern. And the member states hoped that the European Union would take action on that. They may do yet. There's a study ongoing, but we felt there was enough evidence for them to take action on that. It's been a disappointment that the European Union hasn't been more active on that.
Quite on the contrary, the EU even supports wine promotion campaigns and so on.
Yeah, that's right. There's a budget of over 250 million euros from the European Union to the wine industry. That's mostly in France and Spain and in Italy, to promote European wine at European trade fairs and other things. There are also big agricultural subsidies that go to wine producers throughout Europe, but mainly in southern Europe. So the European Union spends a lot of money helping the alcohol industry, in particular the wine industry, and we feel they should be doing more to help prevent alcohol harm, and that's been a frustration.
What is the reason that there is no specific content labeling on alcoholic products?
Yeah, I still find that mysterious. You know, I've been asking that question myself for probably 5, 6, 7 years now, that alcohol products are exempted from alcohol labels. So if you buy a bottle of alcohol-free beer, you will find the nutrition labelling, the amount of protein, the amount of calories in that product. You will also find the ingredients listed on that bottle of alcohol-free beer. But the alcoholic version of that beer will not be required to do that because the alcohol industry is exempted from that. And I think there's no good reason for that. I think it's simply been down to the influence of the industry, their lobbying power, their wish perhaps for the public not to know about some of the production methods, which are not as pure as they would like you to believe, particularly with the wine industry. So I think there's no good reason for alcohol products to be exempted from the kind of nutritional information that people expect on every other product that they have. The milk, the cheese in the fridge, the ham, all of this will have labelling. The alcohol will not, and I think that's an indefensible position, but it's been very difficult to get any movement on that.
One last question in two parts. Your title of the presentation was actually, are NGOs being able to influence EU policies? Are they, and will there be any effect of possible Brexit on your strive to combat the alcohol industry, basically?
Yes, two interesting and difficult questions. I think NGOs have worked hard, but it's difficult. There are many powerful economic interests who are arguing, against the kind of measures that we want to achieve, and it's been a more difficult environment, I think, in the last 5 years in Europe to progress those arguments than it was beforehand. On Brexit, I'm from Scotland. We voted 2-1 to remain in the European Union. In my own country, I don't know what's going to happen. No one knows what's going to happen with Brexit. I don't know what's going to happen with Scotland and Europe. But it's very important for us to work in international cooperation. It's very interesting, and I think it's important and valuable. We can learn a lot from each other. So whatever happens with Brexit, and to this date no one knows, but I hope that it's not going to interfere with the kind of international cooperation that I think is important to tackle the big health challenges that we're facing.
Dr. Rice, thank you so much for your interesting insights. Thanks.
Okay, thank you. It's a pleasure.